So a lot of questions have been asked in the recent past about cardiac arrest and a heart attack. And people do not seem to know the difference, and people are using these terms interchangeably. So we decided as a Care Pharmacy to highlight the differences between these two very tough conditions, and that, we just lay information out there, we can actually save a life. So my name is Migod Julia. I'm the Managing Director for Care Pharmacy. So Care Pharmacy is a mid-chain pharmacy with branches in Nairobi and Machakos. And today with me is a paramedic, someone who's very knowledgeable on matters emergency medicine. And let's listen to him and just get to know what is the difference between these two conditions.
Thank you. My name is William Kimanzi from the Quick Fix. We train on first aid, emergency medical care, and we teach Kenyans on how we can be able to save lives before we involve the emergency medical services.
As an experienced paramedic, tell us the difference between cardiac arrest and a heart attack.
Right, so a heart attack happens when there is blockage of the vessels which supply your heart with blood. So the vessels become clogged, and the clot causes blood not to flow to part of the heart muscle, and this causes pain, which now is the heart attack. Sudden cardiac arrest is when your heart suddenly stops working, and this is usually accompanied by collapse, generally.
So that means when someone gets a heart attack, they necessarily do not collapse.
Not really. So the heart attack will be signified by severe pain in the chest, so crushing chest pain.
So the person will be seen holding their chest?
Yes, they might be seen holding their chest. That is one of the main signs, especially in male victims, because for the female victims, they tend to have slightly different symptoms from the males, but chest pain is a common sign during an heart attack.
Okay. So for cardiac arrest, it's totally the difference.
So for the cardiac arrest, the heart attack might lead to a cardiac arrest if it is left untreated. But for the cardiac arrest, a person falls to the ground, they collapse, there is no breathing, and they do not have a pulse.
Uh-huh. So when you say a heart attack can actually lead to cardiac arrest.
Yes.
So is it at the same time, or would someone get a heart attack and then, they get a paramedic and there's quick response, and then maybe they go home? Would they now maybe get a heart attack, a cardiac arrest at another time, or just during this heart attack episode, that's when a cardiac arrest would happen?
Right, so during the heart attack, the blood vessels become blocked. And if this blood supply to part of the heart muscle is not going to be restored, then it's eventually going to cause the heart to stop pumping, which is now the cardiac arrest. So within the first few minutes after a heart attack, if intervention is given, if you're able to get the emergency medical services there on time, or take these people to the hospital and intervene before getting them to advanced medical help, then it can be able to prevent them from going into cardiac arrest. But if nothing is done, the clotting progresses, the blockade becomes more imminent, then the person will eventually go into cardiac arrest and their heart will stop.
Uh-huh.
Yes.
What are the warning signs? What warning signs should people look out for? What is so distinctive between a cardiac arrest and a heart attack?
Right, so for an heart attack, this will typically begin with the chest pain at the center of the chest, and this is usually squeezing pain. Most patients describe it as feeling as if there's something heavy being placed on their chest. The pain might be felt in other places of the body, for example, on the left hand and towards the back. And they might also have nausea, whereby they feel like vomiting. Others might actually vomit. These people might be experiencing also shortness of breath, so they'll be having difficulty breathing. They are struggling to breathe. And general restlessness. So this person is not normally the way that they usually are. There's a sense of impending doom. They feel as if they are going to die. They feel as if they are going to actually stop breathing. Yeah. And for the cardiac arrest, this is usually signified mostly by failure to breathe. So the person collapses, and when they try checking for breathing, you're not able to see any rise and fall of the chest. You're not able to hear them breathing. And when you check for a pulse, this person does not have a pulse.
So what are the warning signs that someone should actually look out for? You know, the way it would be so easy to know that, you know, you're having flu symptoms and you could say, chances are tomorrow I'll be down with flu. Yeah. So about cardiac arrest and a heart attack, what are the four warnings, the four warning signs that someone should look out for?
Okay, so by the time you get the warning signs, it might be too late. So we emphasize on the need for regular wellness checkups. So having doctor visits will tell if you're at risk of, say, something like an heart attack, because they're able to tell from the ECGs and other lab tests. But what will happen just right before you start having pain from an heart attack is you might experience pain when you're doing something intensive. For example, when you're going up a flight of stairs, you might be experiencing chest pain, which comes and goes. When you try to lift something heavy, you might be experiencing crushing chest pain, which again comes and goes. And these are warning signs that you could be having narrowing of the blood vessels, which now when it becomes a complete clot or a complete blockage is going to lead to an heart attack. For cardiac arrest, this is usually observed through a person becoming unresponsive. So they become unconscious, they do not have breathing, they do not have a pulse. Or in some cases, they become unconscious, but they have abnormal breathing or they're only gasping. In this situation, this person is in cardiac arrest.
Okay, so for heart attack, someone can actually foretell in a way.
Yes.
But for cardiac arrest, no?
It's sudden.
It's sudden. So that means it is important, like you say, to keep visiting your cardiologist or just your GP so that you are able to to know the state of your heart. Because you, as you mentioned, it's a heart attack that eventually leads to cardiac arrest. Okay, thank you. So William, if someone was to have a heart attack, what is the first response? And you've ascertained this is a heart attack. I mean, now that you've told us the difference, what is the first response? And then, of course, what is the first response when someone has just had a cardiac arrest?
Right, so let's begin with an heart attack. You first need to activate emergency medical services as soon as possible. So get an ambulance or any quick means through which you can get to the nearest suitable facility. After that, you need to check through the person's medication if they have been seen before by a doctor and they've been prescribed blood thinners, for example, aspirin. Then you'll need to have this person chew and swallow about 300 milligrams of aspirin. So in most cases, you'll have aspirin, that is cardiac aspirin or Ascand, which are usually blood thinners given to someone who is likely to develop a clot that is likely to cause narrowing or blockage of the vessels within the heart. And for prescription, this is usually given as a 75 milligram tablet. But for an actual heart attack, you need to chew 300 milligrams or thereabout of the aspirin. So that means if you have 75 milligrams tablets, you need to take 4 of them at the same time.
Oh, they will just take all of them?
Yes.
Okay.
And it's important for you to not use water when taking the medication. So chew them as they are for quick absorption.
Okay, that's for someone experiencing a heart attack?
Yes.
Okay. Yeah. So what of the cardiac arrest? I mean, there's a bystander and then somebody just collapses?
So for sudden cardiac arrest, you'll need to start CPR as soon as possible. CPR means cardiopulmonary resuscitation. So cardio is the heart, pulmonary is the lungs, resuscitation simply means to bring back to life. So CPR is a method which we are going to demonstrate, which basically shows how to resuscitate basically, or how to bring back to life both the heart and the lungs, because at that point that someone is in cardiac arrest, the heart is not pumping blood to the brain among other organs. And you have about 10 minutes or so from the moment that your heart stops to the moment that you suffer irreversible brain damage. So we need to get your heart pumping blood to the brain as soon as possible.
So about the heart attack, how long does it, how long someone have until they actually get, at what point would it not be detrimental?
Right, so for one heart attack, get medical help as soon as possible. Of course, people respond differently to treatment, and you need to just give them the best chance of survival. Within the first 10, 15, 20 minutes, if possible, that this person already have taken the prescribed cardiac aspirin, if it is available, and they should already be on their way to a facility. If the cardiac aspirin is not available, it's not among their prescription medication, then we should already have called for an ambulance or looked for a way to get this person to the hospital. So as soon as possible.
Okay, thank you.
So to perform CPR on someone who has gone into sudden cardiac arrest, you need to have them on a flat, firm surface. So that means if they are on the bed, you'll need to lower them to the floor or to the ground. After that, you need to locate the center of the chest. So make a straight imaginary line from their armpits up to the breastbone or to the center of the chest. Use the heel, that is the lower part of your strongest hand. Place it at the center of the chest. Lock with your other hand. Come as close as possible to the casualty or to the victim, and then push hard and fast at the center of the chest continually as you wait for medical help. So I'm going to start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30, 31, 33, 34, 35, 36, 37, 38, 40. And you will keep on pushing hard and fast at the center of the chest until medical help gets to where you are. It's advisable to stop after every 240 compressions. Compressions are is the pushing, so chest compressions. After 240, it is advisable to stop so that you can reassess your victim, check if they have started breathing, and check if there are any signs of life which are back. If nothing, and you have somebody to assist you, you can have them take over CPR as you continue looking for medical assistance. So after every 2 minutes, which will be about 240 chest compressions, switch the rescuers if you have more than one people assisting, and continue seeking for medical help.
So William, when these conditions present, whether an heart attack or a cardiac arrest, how can someone call for emergency?
Right, so calling for ambulances, emergency medical assistance is very important. You can call Red Cross or E+ on 1514, which is a toll-free number, or you can reach them on 0700 395 395. You can also call St. John Ambulance, who are available on 0721 225 285. You can reach out to AAF, that is available on 0725 225 225 again. And then finally, you can also reach out to Rescue or Flare, who are available on 0714 911 911 or any other emergency number, because sometimes we have specific ambulance agencies that we need to reach out to depending on our insurance providers. So if your medical insurance provider has provided a very specific emergency medical hotline, then you can also use that as well to get an ambulance.
Okay. And you can also reach out to Care Pharmacy. We'd be more than glad to help link you to the nearest emergency services. We have all these numbers with us. So how can someone go about CPR training? Because I think it's quite important that people get trained, so that in case this occurrences, these two things happen, then they are able to actually support the patients.
Right, so we do offer first aid and CPR courses to non-healthcare providers, that is the lay responder, people who have little to no medical training. We also offer these to schools, to individuals, to organizations, and to corporates as well. And we also have courses for healthcare providers, for the nurses, pharmacists, medical officers, and the likes. And this is usually the BLS, basic life support, and advanced cardiovascular life support courses. So we have the whole catalog available on our website, that is the quickfix.org.
Okay.
Yes.
So is contact information will be in our comment section, so that in case anybody needs this CPR training, then please kindly reach out to William. Thank you so much, William, for your time, and thank you for the invaluable information that you've given us here today. I want to believe that this is information that will save a life. It will actually make a difference for somebody out there. So Karakea Pharmacy is pleased to have had you on talking about this. And at Karakea, we are very passionate about outcome, pharmaceutical outcome. And this is a topic that we thought was actually very necessary to bring it out there, just so that we create more awareness on the difference between heart attack and a cardiac arrest. So stay tuned for more of this.